Welcome back to FedBiz Exchange. I'm Michelle Brown, your coach and your mentor. You know what time it is. It's time for Ask Michelle B. So let's get into it. Sunny has a question. Her question is, she and her friend are starting a business. They're both in healthcare. They want to know, how should they use their healthcare RN case management experience to win government contracts. So let's get into it. Hey, you guys, I know government contracting can be a little bit challenging sometimes, but don't forget you have Ask Michelle B. Just click on the link below in the comment section and ask me anything you want to know about business and government contracting, and I will send you a personal email, but I'll also let our audience know because I'm positive there are many out there that have the same types of questions. So let's get back to our question.
Hi, Michelle. My name is Sunny. I enjoyed your presentation on government contracting for healthcare. Have a question for you. My friend and I, she's an RN case manager. She has worked in government entities, like for some of the military hospitals out in Reno, but we're interested in partnering together. I'm more the case manager coordinator, and she's the case manager RN, and seeing how we can put together both our abilities. We worked together at one time for a hospital facility, and just seeing how we both can benefit and put our services together. We're both open to staffing, as well as I'm thinking we're probably going to lean more towards maybe offering supplies or some type of medical supplies. So I would appreciate if you can respond back and perhaps let us know your thoughts. Thank you.
Hi, Sunny. Thank you so much for your question. The question about your healthcare RN case management experience and how you should use it. Should you begin with staffing or should you begin with medical supplies? Well, you may not know this, but I do come from the healthcare industry on the pharmaceutical side, and I win my contracts with medical supplies. However, for you, because of your experience, I would tell you, you and your partner need to begin with staffing. Here's why. You have a tremendous amount of experience between the two of you, and the most important thing that goes along with your experience is that the government, federal and state, city and county, all of these government entities need healthcare services, specifically nurse staffing services. We do not have enough doctors. We do not have enough nurses, therapists in all areas of healthcare. So you guys are in a great spot. And if you're ready to start, you could become a multi-million-dollar business around government contracting in no time. I'm talking in less than a year. So you have to be ready. You need to be ready for what is being asked of you. I believe you guys can offer the services, but you need to be ready from a business perspective. So you need to map this out. Map it out, decide what you're going to focus on, and I'm going to show you before this video is over the areas, just a few, where the government is desperate for help. Registered nurses is one of those areas, and because that's your industry, this is where you should focus. Medical supplies can come later, because I do believe you need to have more than one stream of income. But right now, staffing is hot because of the COVID pandemic. People don't believe that it's that serious, but to the government, it is extremely serious. They are desperately in need of help for therapists and registered nurses. Not as much physicians, they need them too, but more of the support for doctors and procedures and very serious illnesses because of COVID-19. So if you guys are not registered in SAM, get registered and get busy. And hold on, I'm going to show you some opportunities that would be coming your way if you decide to move forward with government contracting. Sunny, here is an example of the nursing opportunities that are out there. If you and your partner are interested in making money right away, you should start with staffing. And this is where your experience is, but I just wanted to show you very quickly in SAM.gov the opportunities that are out there for January 2022 going forward. As I stated, staffing for healthcare and anything in healthcare is needed right now because we are still in a pandemic for COVID-19, whether people realize it or not. So that means the government is in trouble when they try to seek assistance because there are not enough people trying to help with the staffing, the healthcare. This is on a federal level and a state level. So I just wanted to let you know that this is a good area. And with your experience and your partner's experience, you guys could be doing multi-million-dollar contracts in no time, but you need to start. You need to get started. You need to get set up in SAM if you're not already there, and start bidding as soon as you get set up because you know what you're doing. That's the ticket because you already have the experience. Okay? Thank you.